Good morning. I wanted to touch base with you again regarding COVID-19. As you know, according to the CDC, the primary symptoms to be aware of: fever, shortness of breath, dry cough, chest pain can be one, fatigue. Also, be aware that some individuals they found are also experiencing loss of a sense of taste and or smell. Now, those are also associated with things like the common cold, though. So just be aware of that potential in the differential diagnosis. If you develop those symptoms, it might be worth a call to your primary care. In addition, according to the CDC, those individuals at highest risk of COVID-19 include those who are 65 and over, those who have chronic lung conditions like moderate to severe asthma, certainly emphysema and COPD would be on that list. We have to look at those people who are immune compromised, perhaps due to cancer therapy, or those individuals who may have an autoimmune condition as well. We have to look at individuals who have severe heart conditions, as well as individuals with a BMI of 40 or higher, because those individuals more likely develop over time renal disease, diabetes, again, heart conditions. In addition, be aware that pregnancy is also a risk factor for vulnerability, if you will, of contracting COVID-19, just because during the pregnancy the immune system is somewhat compromised. Again, as I've posted or stated in prior videos, our office is taking severe precautions now. We only have one patient in the office at a time, and prior to any patient entering our office, they're going through a verbal pre-screening process, whether it's over the phone from home or when they arrive in our parking lot. We ask a number of questions very pertinent to exposure as well as symptomatology. If all those questions are negative, then the patient will come into a room dedicated to checking temperatures. If all that checks out well, then you'll come in for your treatment. After your treatment, the table is thoroughly disinfected, as are the adjusting tools and any diagnostic tools. Gloves are changed, clean gloves. I'll be wearing a mask. It's very difficult to put a patient through this pre-screening process, only because there have been times over the last 2 weeks now we've had to deny or defer treatment. And not that anybody that we've encountered has tested positive for COVID-19, but there was at least a small risk of exposure. Perhaps somebody just traveled within the last week or two overseas especially, or had a fever a couple weeks ago, whatever the case may be. So we want to make sure that any individual that comes in the office after that pre-screening process is safe to be in the office. For those individuals that we've had to deny or defer care, we feel very badly about that. But please understand, we have to do it not only for your good and ensure you follow up with the appropriate medical personnel, but also for the overall state of well-being for our patient population. We want to have as safe and healthy an environment as possible for our patients. So yes, it's very difficult to deny anybody for care, and we really bring that up with our older patients. We have patients certainly in their 70s, 80s, even 90s. And unless it's critical, and we'd have to have a conversation over the phone about that, I really feel it's better we hold off on care now until we really get more information from the CDC and even more information from the governor and Mecklenburg County officials, so we make sure it is safe for everyone to get care. And again, it's a very difficult thing for us to do. Again, I say to defer care to anyone, but understand we're really doing it for your benefit, and I hope you understand that, as well as the benefit of all our patients. Until I speak with you or see you next, stay strong, stay healthy.